Hey there, welcome to another video. Today, we're diving into a topic that affects millions of people worldwide. Depression. If you've been feeling off lately, more than just a bit down or tired, you might be wondering, am I depressed? This video is designed to help you understand what depression is, recognize its signs, and provide practical steps you can take if you think you might be depressed. Let's get started. First things first. What exactly is depression? We all feel sad or low at times. It's a natural part of life. But depression is more than just a temporary mood swing or feeling blue. It's a mental health condition that can affect how you think, feel, and handle daily activities like sleeping, eating, or working. Depression can make you feel like you're stuck in a dark place with no way out. But remember, it's not a sign of weakness, and you're not alone. Millions of people experience depression, and it's okay to seek help. So, how can you tell if what you're feeling might be depression? Here are some common signs and symptoms to watch out for. Persistent sadness or low mood. This is one of the most common symptoms. If you feel sad, empty, or hopeless most of the day, nearly every day, for at least 2 weeks, it could be a sign of depression. Loss of interest or pleasure. Depression often makes you lose interest in activities you once enjoyed. Hobbies, socializing, even things that usually make you happy can start to feel like a chore. Fatigue and decreased energy. Do you feel tired all the time, even after a full night's sleep? Fatigue is a common symptom of depression. It can make it hard to get out of bed, let alone go about your day. Changes in sleep patterns. Depression can cause you to sleep too much, hypersomnia, or too little, insomnia. It's not just about feeling sleepy, it's about the quality of sleep and how it affects your daily life. Changes in appetite or weight. Some people with depression may lose their appetite and weight, while others might eat more and gain weight. It's about a significant change in your normal eating habits. Difficulty concentrating. Depression can make it hard to focus or make decisions. You might find yourself forgetting things more often or struggling to think clearly. Feelings of worthlessness or guilt. You might start to feel like nothing you do is right, or you're constantly burdened by guilt, even for things that aren't your fault. Thoughts of death or suicide. In severe cases, depression can lead to thoughts of death or suicide. If you're experiencing these thoughts, it's crucial to seek help immediately. Physical symptoms. Depression isn't just in your head, it can affect your body too. You might experience headaches, stomach aches, or other unexplained physical problems. Now, it's important to understand the difference between feeling sad and being depressed. Sadness is a normal human emotion, it comes and goes. You might feel sad after a tough day at work or after hearing some bad news. But depression is more intense and lasts longer. Here's a quick way to tell the difference. Sadness is usually tied to a specific event or situation. For example, losing a loved one or facing a major life change. Depression doesn't always have a clear trigger. You might feel down for no apparent reason, and those feelings can last for weeks, months, or even longer. If your low mood is persistent and you're experiencing multiple symptoms we've just discussed, it might be more than just sadness, it could be depression. So, how can you figure out if you might be depressed? Here are some practical steps you can take. Keep a mood journal. Track your mood daily. Write down how you're feeling, what you're thinking, and any physical symptoms you're experiencing. This can help you spot patterns and triggers. Rate your symptoms. On a scale from 1 to 10, rate the severity of each symptom we talked about earlier. This can help you understand how much these symptoms are affecting your life. Talk to someone you trust. Sometimes, talking to a friend or family member can give you a new perspective. They might notice things about your behavior that you haven't. Take an online depression screening test. There are many reputable online tools available. While these aren't a replacement for a professional diagnosis, they can give you a better idea of what you're experiencing. Reflect on recent life events. Have there been significant changes or stressors in your life recently? Understanding the context can help you determine whether your feelings might be related to these events or if they're more pervasive. If you think you might be depressed, it's important to seek help sooner rather than later. Depression is highly treatable, but the first step is recognizing that you need support. Here are some signs that it's time to see a professional. Your symptoms have lasted longer than 2 weeks. Your symptoms are interfering with your daily life, like your job, relationships, or school. You're having thoughts of self-harm or suicide. If you've decided to seek professional help, you might be wondering what to expect. Here's a quick overview. Initial consultation. You'll start with a discussion about your symptoms, medical history, and any recent life changes. The healthcare provider might ask you to fill out a questionnaire or self-assessment form. Diagnosis. The professional will determine whether you have depression based on your symptoms and how long you've been experiencing them. They may also rule out other conditions that can cause similar symptoms, like thyroid problems or vitamin deficiencies. Treatment plan. If you're diagnosed with depression, your healthcare provider will work with you to create a treatment plan. This might include therapy, medication, lifestyle changes, or a combination of these. Let's talk about the different treatment options available for depression. It's important to remember that what works for one person might not work for another, so finding the right treatment can take some time. Therapy. Cognitive behavioral therapy, CBT, is one of the most effective types of therapy for depression. It helps you identify and change negative thought patterns. Other types of therapy, like interpersonal therapy or psychodynamic therapy, might also be recommended depending on your situation. Medication. Antidepressants can help balance the chemicals in your brain that affect mood and emotions. There are different types of antidepressants, so your doctor will work with you to find the one that's right for you. It's important to take these medications as prescribed and give them time to work, usually a few weeks. Lifestyle changes. Small changes in your daily routine can make a big difference. Regular exercise, a healthy diet, and getting enough sleep are all crucial for managing depression. Mindfulness practices, like meditation or deep breathing exercises, can also help reduce stress and improve your mood. Support groups. Joining a support group, either in person or online, can provide you with a sense of community. Connecting with others who are going through similar experiences can be incredibly comforting and validating. Alternative therapies. Some people find relief through alternative therapies like acupuncture, herbal supplements, or yoga. However, it's important to consult with your healthcare provider before trying any alternative treatments, especially if you're already on medication. It can take time for treatment to start working, and during this period, it's essential to have coping strategies in place. Here are a few things you can do to manage your symptoms in the meantime. Practice self-care. Take time for yourself each day, even if it's just for a few minutes. Whether it's reading a book, taking a bath, or going for a walk, do something that makes you feel good. Stay connected. Isolation can make depression worse. Try to stay in touch with friends and family, even if it's just a quick text or phone call. Let them know what you're going through. Having someone to talk to can make a big difference. Set small goals. Depression can make even simple tasks feel overwhelming. Break down your to-do list into small, manageable goals. Celebrate each small achievement, no matter how minor it might seem. Practice mindfulness. Mindfulness techniques, like deep breathing exercises or guided meditation, can help you stay grounded and reduce anxiety. There are plenty of apps and online resources to get you started. Avoid alcohol and drugs. It might be tempting to use substances to numb your feelings, but alcohol and drugs can actually make depression worse. They can interfere with your treatment and increase the risk of harmful behaviors. Let's clear up some common myths and misconceptions about depression. Depression is just sadness. Depression is a complex mental health condition that affects many aspects of life, not just mood. You can just snap out of it. Depression isn't something you can simply shake off. It often requires professional treatment. Only weak people get depressed. Depression can affect anyone, regardless of their strength, background, or personality. Talking about depression makes it worse. Talking about your feelings with someone you trust can be incredibly helpful and is often the first step toward healing. Antidepressants are a lifelong commitment. Reality, while some people might need long-term medication, others might only need it temporarily. This is something to discuss with your doctor. If someone you care about is showing signs of depression, here's how you can support them. Listen without judgment. Let them talk about how they're feeling without interrupting or offering advice right away. Just being there to listen can mean the world to someone who's struggling. Encourage them to seek help. Gently suggest that they talk to a healthcare provider or therapist. Offer to help them find resources or go with them to their first appointment. Check in regularly. Depression can make people feel isolated. Regular check-ins, even just a quick text to say you're thinking of them, can make a big difference. Offer practical support. Depression can make everyday tasks feel impossible. Offering to help with chores, errands, or even just bringing over a meal can be incredibly supportive. Be patient. Recovery from depression takes time. Encourage them to be patient with themselves and be patient with them as they navigate their treatment. Depression is tough, but remember, you don't have to go through it alone. Whether you're experiencing symptoms yourself or supporting someone who is, there's help and hope available. The most important step is recognizing the signs and reaching out for support. If you found this video helpful, please give it a thumbs up, share it with someone who might benefit, and subscribe to our channel for more content on mental health and well-being. Thanks for watching and take care. See you next time.